Insulin mixing. Insulin mixing help us for the client's blood sugar level to reach the level target. It is combined with short-acting and then long-acting. The short-acting insulin is the clear one, and then the cloudy one is the long-acting insulin. For the assessment, we are going to identify the client and then explain the procedure for us to prevent anxiety or alleviate it. And then for the second one is we are going to check the client's most recent blood glucose level for us to prevent any hypoglycemic level episodes. And then we have to check the client's medical record, and then for us to be sure of what he's saying and then all the other conditions he is in. And then for the planning, we have to organize all the materials we are going to need to minimize our time, and then for us to be organized, we are going to need medical administration record, syringe, alcohol wipes, and insulin vials. As for now, I don't have any insulin vials available, but we are going to use a normal saline. For implementation, first we are going to wash our hands to prevent microorganisms, or we can also wear gloves. And we have to remove the caps from insulin vials, and then gently, assuming na natanggal ko na po, and then gently rotate, but never shake it for us to let the sediments in equal suspension po. Yan po. And then, after that, we are going to wipe the top of the vial with alcohol wipes for us to prevent the microorganisms in the surface of the vials. And then draw back the amount of air into the syringe that equals the total dose of both insulin solution for us to prevent negative pressure from pulling solution into vial for next use, and then for us to prevent contamination with different types of insulin. First, we are going to remove the syringe, and then unahin po natin yung cloudy, which is the long-acting insulin. Example is we are going to draw back a 5 ml of air into the and then the second one is we are going to also 5 ml equal to the cloudy to the short-acting insulin, which is the clear one. Then, hindi po natin tatanggalin. And then, invert the clear acting. And then, kuwari po, kukuha po tayo ng 5 ml of solution. And then, the next one is the cloudy one, which is the long-term acting insulin. And then, addition of 5, so it is total of 10 ml. And then we are going to check the solution if there is any bubbles present, and then we can also ask the other nurse for if we reach the desired level of insulin. And then cap the syringe. And then we also have to store the insulin properly according to the manufacturer's specification for us to ensure the effective product. And then at last, we are going to wash our hands, prevent transmission of microorganisms, and then prepare the injection for us to be ready for the injection. And then lastly, for evaluation, we have to document the procedures done and then all the assessment findings for us to, in order to have accurate date, and then for collaborative management, and then continuity of care. And then um, um, organize the materials that is used.